a lot of the crazy stuff that's going on in Washington, but I always want to be respectful and thankful. I remind you, if you're 65 and older and you have any symptom whatsoever, you've got to go get that test, as I said a few minutes ago. I remind you about face coverings. If you're 65 and older, you're going into a crowd of people, you don't know them, you've got compromising issues, whether it be lung, diabetes, whatever it may be, you need to think really hard about wearing a mask. This one is the one that just drives me crazy and everything, that's the booster shots. If you haven't gotten your booster shot and you're fully vaccinated, I don't get it. I just don't get it. How in the world could you have made the decision to get vaccinated 2 times and know by all the stuff that the experts are telling you that's useless now? That's gone. You made a decision to get vaccinated to stop this thing and help protect you. And now I'm telling you, Dr. Marsh is telling you, Dr. Amja, all of our folks are telling you that really all the research says that the vaccinations that you have, if you're 6 months out or 5 months out rather, on Moderna and Pfizer, or 2 months out on J&J, you might as well not have even gotten the vaccine. So how can you hold up and wait on this booster situation? I sound like a preacher, but I am telling you with all in me, and I'm super respectful to all of our folks that that are preaching and especially the wonderful words of the gospel and all that. But just think about it, please. How in the world can you not put this on the top of the shelf? The number one thing you need to do today is get that booster shot. We're still at 70.9% of the 18 and above that's gotten one shot. We're just hanging in there, and we're slow but sure getting there. But I wish to goodness we'd move it faster. That's for sure. I want to say this too, though. From the standpoint of these mandates, on getting your vaccines or getting fired, and if you haven't been vaccinated or this, we've got to mandate, for our kids to wear masks at schools and all that kind of stuff. We offered up some level of local control, and those folks did a good job. But from the standpoint of mandating, we're way past that, are we not? And we've got to move on. We've got to encourage people to get vaccinated, get their booster shots and everything. I really believe that with all in me, but we don't need to be mandating stuff on our people, and we need to be really respectful of all people's views in this great country. It made us what we are. I mean, for crying out loud, we can't just throw that away. It made us who we are. It made this nation the greatest nation on the planet, and it'll make it stay that way too. I remind you about the COVID, our COVID vaccine info line, all kinds of information up there. Take advantage of the free testing. I thank Frith, I thank Walgreens for all that they've done. We have 161 outbreaks in our long-term care facilities, 1 in our church community, that's in Nicholas County. Corrections still, the numbers still keep going up and up and up, but these corrections people, these folks under Jeff Sandy and all the good work that corrections is doing and everything, they've done phenomenal. They really have, and they've protected our inmates, they've protected our staff, folks, and they do a really good job. But there is 927 inmates with COVID right now and 230 staff cases. So that's not what we want, and we're on it, and hopefully that'll turn real soon. From the standpoint of our rental assistance program, if you're a renter, if you're a landlord, all you got to do is pick up the phone and call us, see if we can get you registered and everything, see if you qualify. If you qualify, we'll send you some real money. And not only will that help you, but it'll help all the state of West Virginia, because those multiplier effects of those dollars are really meaningful. So just try to remember that. I've got 3 more things here real quick. One is a reminder about giving blood. That's super important. And and today is a special day. You see me wearing my tie, wearing a red tie and everything for a special day for women's heart health, and you know, and wearing red today, we you know, you know, we want to be super respectful in all ways, and anything we can do to just move the needle and make things better for our folks, especially the women. This is a wonderful, wonderful day. So I recognize and celebrate this day for women's heart health. Last thing I've got is our DNR officers, you know, to jails. We have more than 60 police officers with the West Virginia Division of Natural Resources that have completed specialized training to assist our Division of Corrections and Rehabilitation. So we got a bunch of folks that have stepped up. We've got 61 officers that now can fill support roles at the West Virginia prisons and jails, and we thank them so much and everything. You know, you got a lot of people. I mean, just think, all across this state, what have we done? We've pulled the rope together. We've held hands. When absolutely somebody was in need, somebody stepped up. You know, it is a reflection on West Virginia through and through. You know, I have said it and said it and said it. And that's why I absolutely step up and defend West Virginia and West Virginia folks in every way. I mean, when it really comes right down to it, we have the very, very best people, and they do incredible work. They are just rock solid, grounded, good people. And you know, if you just think about this, these DNR officers and everything stepping up to be able to fill a vacancy if we needed so, and basically just help out. You know, it's amazing stuff. So thank you guys and ladies, and I'm really proud of you. But I thank you from the bottom of my heart. West Virginia thanks you, and let's just keep pulling the rope together. That's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. In reflecting on what the governor has shared with us, it is quite important to recognize that West Virginia looks like that we have seen the peak of the Omicron cases, and now we believe that that is starting to recede. We see that the RT values remain under 1. Today it's 0.94, and the number of average daily cases has gone down over the last 4 or 5 days, as well as the percent positive has gone down. That means to me that we would anticipate hospital numbers will be the next focus for us. And in general, we have seen hospital numbers continue to rise after the peak in the cases in other countries. And also, we know that after that follows an increased number of people who die of COVID-19. So as the governor said, a critical and central opportunity for all West Virginians, but particularly for West Virginians over 50 years old and over 65 years old, is to make sure that you have gotten your latest eligible dose of the vaccine. And for people with normal immune systems, that means that you get 2 doses in the first series. The first dose of Pfizer separated by 21 days, the first and second dose of Moderna separated by 28 days, and then 5 months later, you get another dose, which is the booster dose. And that dose is very, very important because, as the governor said, we know that the first 2 doses lose potency over the first 4 to 6 months, and the booster dose returns potency. And that is really, really important across the entire pandemic, but particularly with the Omicron variant, because the Omicron variant is so much more infectious than we've seen before. So we know now data has come out on Omicron suggesting that people that are fully vaccinated with their 2 dose and boosted with that extra dose 5 months after the first 2 doses have a 50% reduction, or have a 2-fold protection against getting infected. Only 50% is likely. have a 90% protection against being hospitalized and have a 96% protection against dying. This is for the Omicron specifically. The governor also mentioned that we have found our first few cases of the second subvariant of Omicron, the variant called BA.2. So in the United States, the BA.1, the original Omicron virus, accounts for about 99% of our cases. And in West Virginia, the BA.1, the original Omicron virus, accounts for 95% of our cases. So we see that we join almost half of the states in the country finding a few cases of the BA.2, which is a subvariant of Omicron. And as the governor said, it's been called the stealth variant. And it's not because it's so much worse than the original Omicron. It's because it has different properties when you use a genetic test to identify it. But what is clear, in some countries, this variant has become the dominant variant and has outcompeted the first variant, the BA.1. But in countries where the BA.1, the original variant, has really moved through the countries or the states, the BA.2 variant doesn't look like it spreads nearly as easily, which suggests that the immunizations that we have and the natural immunity that we get from being infected with the original variant, the BA.1, is protective, it looks like, from keeping that BA.2 from spreading. So we'll watch it carefully. It doesn't seem like it's any more severe. It may be a bit more contagious, but the immunity that we've gained in West Virginia from vaccines, and we hope more boosters, along with people that have been infected and recovered from Omicron recently, should provide us the necessary immune protection so that that BA.2 does not spread widely. Lastly, when we look at our country, we see that the hospitalizations are down, the cases are down, but the deaths have still not gone down yet. And that is a lagging part of this surge. And we know that although the governor reads way too many names every press brief, we still are at risk for more people to die in the next several weeks. And so it makes it really important that people in that 50 over, 65-year-old over age category who have not gotten your next dose 5 months after those first 2 doses, please get that really quickly, because that's the way we're going to protect people from dying in the next several weeks as we hopefully see the Omicron surge start to regress in West Virginia as well. Thank you.
All right, thank you, Dr. Marsh. Retired Major General Jim Hoyer and Secretary Bill Crouch are also joining us today and are available for questions. Dr. Anamjad, our State Health Officer, had a prior engagement and will rejoin us next week. We'll now go to questions from members of the media. The first today from Stephen Adams with Ogden Newspapers.
Yes, Stephen Adams of Ogden Newspapers here. This is a question for all of you if you choose to weigh in. But we're approaching the 2 years of dealing with COVID-19 and now the variants. And I know you all are focused on the short term, but has any thought been given to what to expect or what we expect COVID to look like for the state throughout this year? And by the time we get to the end of 2022, are we planning for this to be endemic? Some lawmakers are still balking at the state being under a state of emergency for the last 2 years. Do we see that possibly being rescinded sometime in the next year? So I'm kind of seeking basically a COVID forecast for 2022 from the health officials, from the governor, for anyone who wants to weigh in on that subject. Thank you.
Well, guys, let me go first. Stephen, thanks a bunch for all you do every day. I think you do good work. Stephen, I'm really not dodging anything here. I think if the health officials were completely honest, they'd feel the same way that I feel. The thing that scares us all is just this, is Stephen, we all know that this thing can turn and snap really ugly really quick. The ugly snap on it that is really quick is the fact that our hospitals are right now, pushing capacity absolutely with staffing and all that. And the ugly thing is, all of a sudden, you've got stroke victims or heart attack victims or whatever, car accidents or whatever, and our hospitals are so covered up that that it becomes, to where we begin to really lose lives that we could be saving. And so that's a real concern, and the other thing is just the fact of the unknown. I mean, really at the end of the day, isn't it more prudent to err on the side of safety and hope that we erred on that side just a little bit, maybe too much? But I'll pass now, to our medical team and experts and everything, and let them talk with you. But and General Hoyer and all those that are watching all the numbers every single day along with me. But Stephen, I really worry an awful lot about our hospitals. That is a gigantic worry. And let me clean up something to make sure everybody understands this. On our call yesterday, with the folks from DC and asking for a waiver with our rural hospitals, basically I mean, for them to just come out and say, no problem, we're going to completely do away with what we put out, and we're going to just say, that we're going to completely give you a waiver on all that. They're not going to do that. But what they very well can do is extend the timelines, work with us on the percentage of folks that are vaccinated at the particular hospitals, and give us leeway to where we don't have to end up having to terminate somebody that we desperately need at a rural hospital. So the net of the whole thing from my standpoint is the hospitals. I really believe that, we're handling this to the very best of our knowledge with the people. Let me mention one other thing real quick, Stephen. I think from Jim Justice's standpoint, what his biggest concern is two things. The older people are not getting vaccinated completely, and the older people are absolutely the ones that now are showing up. It looks like we're moving and trending to where the older folks are dying. And so that's a real concern. And even a concern equal to that is just over flooding our hospitals. But Dr. Marsh, maybe you and General Hoyer or Dr. Amjad, please talk.
Thank you, Governor, and thank you, Stephen. So I would completely agree with the governor's assessment. The only thing I might add is that we are constantly on the lookout for new variants of COVID-19 that pop up, because we did not expect the Delta variant to pop up when it did. We did not expect the Omicron variant to be a completely separate type of variant from the Delta variant. So we have underestimated in some ways this virus for a while during this pandemic, and we no longer will do that. So we, again, believe that the more people that become fully vaccinated and finish their additional shot, their booster shot 5 months after the first two vaccines, will increase our likelihood, not only in West Virginia, but across the country and across the world, of reducing new variants from coming up, will protect our oldest, most vulnerable part of our population, who is dying the most commonly, as the governor mentioned. But to make a prediction at this point, as we're coming maybe just out of the Omicron surge, would be a bit premature. But the more we get vaccinated and the less the virus mutates and creates newer forms that are more capable and we worry more deadly, then we will see this pandemic go to an endemic or an epidemic virus, which means not across the world, but in small outbreak areas that may be distributed across different countries, et cetera, to more endemic, like other viruses like the flu and others. Jim?
Yes, the governor and I've had these conversations when I was adjutant general, and we responded to a number of state emergencies. We have, in these emergencies, we have a response phase and then a recovery phase. And unfortunately, this response phase has gone on over 2 years, but there will also be a recovery phase to this. So he's directed us as a leadership team be prepared and continue to keep the task force structure in place and use it to get us through as we transition into an endemic phase. But the other thing that the governor's tasked us to do that I think is really important is to look at how this task force structure can then be used to address other West Virginia health problems going forward by being that helpful coordinating entity. And I think that's going to pay us big dividends down the road, but we're prepared to continue to work this as a leadership team.
And Jordan, let me come back just 1 second and just say this, Stephen. I knew our people would probably address the state of emergency stuff better, or more. But from our standpoint here, I said err on the side of caution. There are a lot of federal opportunities and everything that could come our way if we lift the state of emergency. That could give us an opportunity to lose something, to tell you the truth. And with all that, there's really no rules or regulations that are in place and in effect right now, in regard to the state of emergency. And it's just there as a safeguard for us right now. And so I see no reason for us to just jump out and lift it just for the sake of saying, well, we lifted it.
All right, thanks, Stephen. Next to Kenny Bass with WCHS and Fox 11.
Hi, good morning and good Friday to you. I have a question about the oncoming vaccine, which is being developed, which is being at least talked about tentatively right now, for people as young as 6 months old. And that dose would be about 1/10 the strength of the dosage that adults get. So question for Dr. Marsh. First of all, in a state where we've had far less than 50%, I think it's 16.9% right now, of 5 to 11-year-olds get the vaccine. Number one, how successful can we be marketing this new vaccine to those with children that young as 6 months old? And two, given how this thing has worked its way through the population, do children that young actually need it? Thank you.
Dr. Marsh, this is you, or Dr. Amjad.
Thank you, Governor, and thank you, Kenny. I think your points are very important. We know from surveys done by the Kaiser Family Foundation that about a third of parents that were queried have already committed to having their youngest children, the 6-month-old to up to 5 years, be vaccinated if these vaccines, the Pfizer vaccine, is approved for emergency use authorization by the FDA and the CDC. And that assessment and decision will come starting on February 15th. We know that, as you said, Kenny, the dose of the vaccine, and this is only for Pfizer that is being evaluated. Moderna is not at this point. But this dose of vaccine has been lowered intentionally. The adult vaccine is 30 micrograms. The dose for children over 5 is 10 micrograms, a third of the adult dose. And the dose of this vaccine for 6-month-olds up to 5-year-olds is 3 micrograms, as you said, 1/10 of the dose. And the goal is to reduce any potential side effects, which none have been seen in the lower doses given to children, like myocarditis or pericarditis. No signal there, which is great. But what the data will be assessing will be that the clinical trial so far shows that the 6-month-old to 2-year-olds have gotten a good antibody response, a good immune response from that low dose of the vaccine, the 3 microgram dose, when given twice. The 2-year-olds to the 5-year-old, that gap, those kids didn't show as robust an increase in antibodies. So Pfizer is testing a third 3 microgram dose for that population. And so the decision will be from the FDA and CDC whether or not that is sufficiently enough information to start that, to approve the vaccine, to give the first and the second shot to children who are 2 to 5, and then anticipating that third dose will make a bigger difference. There's no harm that's come to the children in the study, which is good. And the belief is there may be protection against severe consequences, because we know more children are in hospitals with the Omicron variant than we've seen at any point during the rest of the COVID pandemic. But it will be a very interesting discussion, and we'll see what happens when the FDA and the CDC meet. Thank you for the question.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I had a few questions about the natural resource officers that are currently helping out with corrections. So do we have an idea of the duration of the assignment, how long they'll be there helping? Are we currently training additional people beyond the 61 to try and bring them on as well? And I saw elsewhere that these guys had volunteered for the training, but are they being compensated? And if so, where's that money coming from? Thank you.
Charles, I guess this is probably a question for me, but you know, first of all, as far as the money, you know, hopefully this is a real temporary situation and everything, and these people have volunteered, you know, to be able to help us out, and it was a real good gesture and everything. But we're working, you know, with these people, you know, to make a decision to get these people into these positions and everything. I think it's a little premature for me to be able to answer particulars about your questions about what's going on. But these people have really stepped up and they have volunteered, and so that's really good.
All right, thanks, Charles. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. Question to General Hoyer about the Guard working at the hospitals. What sorts of things are they helping out with? I know that just not anybody can do any job at a hospital, and I know they're doing the best they can wherever they're being assigned, but what sorts of duties do they fill at these hospitals to make it a better situation there? Thank you. General, please. You got to be the best at this.
Yes, sir, Governor. So, Paul, a wide variety of tasks. As you know, when you go into a hospital facility now, there's a screening process. A lot of times what hospitals have had to do is to pull patient care technicians or other ancillary providers off of duties and put them on those assignments. So Guard folks coming in to relieve some pressure in some facilities related to that has been helpful, putting people back into patient care. I was at Ruby day before yesterday, and there were guardsmen who were providing support by moving patients to testing procedures, which freed up nurses and patient care technicians to do other patient care duty. There have been some guardsmen that have assisted in helping get ancillary facilities back up, such as laundry facilities that went down because of people being out. So it's a broad spectrum, and the governor, General Crane, and all of us appreciate the great work and the flexibility of those men and women. And I will tell you, Paul, that the response from the hospital CEOs on our weekly calls and the discussion I had with some providers in the hospital the other day is just absolutely amazing. It's greatly appreciated that others have come on the front line to support our healthcare workers.
All right, thank you, Paul. Next to Mark Curtis with Nexstar Media.
Good morning, everybody. Governor, I have a non-COVID related question. I'm just wondering what you're hearing from your emergency management folks, National Guard, or anybody out, the Division of Highways, dealing with the latest winter storm overnight and the ice in certain parts of the state, and just kind of give us a sense of how the state's response is going and how conditions are.
Mark, I think it's good. We got to be careful, and you know, with the temperature, you know, with all the you know, humidity and moisture and everything, and the temperature, you know, hanging in there right at the point in time where you could get black ice and freezing rain. You know, not only do we have to be careful driving on our highways, but we got to be careful, people flying, because freezing rain is a death sentence. So you got to be really, really careful there. We have had some minor flooding reported. We're keeping our crews, ready to go, and they're on their game. And so all the agencies are on high alert. But I think this thing's going to, not be as severe for us as some other states. But and that's good stuff.
Thank you, Mark. Governor, I'll turn it back to you.
Well, I'll tell you honest truth. I've covered most of the things that our experts have mentioned earlier. Like I said, we do have some minor flooding that is in certain areas, and we all of our agencies have been alerted in regard to that. We're watching this storm. There's no question, Dr. Marsh, or I brought up, there's another variant floating around out there. I think it was Berkeley and Ohio counties. We've picked up on it and everything. They're calling it, I think, Omicron 2. All of us are exhausted totally to death with the next variant. But we got to know, that this virus stuff is probably not just going to go away. And it's surely not going to go away until like I said, the really smart people, the medical community, whomever it may be, a scientist, is able to come up with something that just shuts this thing down. But hopefully, as we go, as Dr. Marsh has said, this variant is not alarming to us. It's not driving the boat in a more serious way or more alarming. And so I just think if we can just keep being smart as people, and know that we've lost 5,846 great West Virginians, but we want to continue as a state to be smart, pull the rope together, protect yourself. Don't absolutely just be foolish. And I think it's foolish in regard to the boosters. If you've been fully vaccinated and don't take the booster shot or haven't taken it, I don't know what you're waiting on there. We're going to respect everyone's opinions and beliefs in regard to taking the vaccine, not taking the vaccine. We're going to continue to urge people, but really and truly, every single time we get a little bit more people that are vaccinated, we get a little bit closer to a situation like Dr. Marsh has said, whether they talk about, countries that are, completely vaccinated or whatever it may be. And Dr. Marsh said the other day, I think, or General Hoyer said, maybe it was General Hoyer said, of the deaths that I read, that were predominantly older people, he said maybe we could have reduced that by 99%. It's unbelievable. So really and truly, just consider getting vaccinated, get boosted for sure, and just watch and just be careful and be respectful of your neighbor and everybody's wishes. And let's just keep pulling this rope together, West Virginia. We're getting there, and we're going to get through this. And God bless all of you. And think about, women's heart health today too, please. But nevertheless, thanks again.